facial hair. But if people can just briefly look at that, I actually think that this exemplifies a lot of principles of a good letter of recommendation. So if people can maybe figure out why I think this is a good letter of recommendation and convince yourselves that I'm not just doing this because I like to talk about my kids.
I think the first paragraph gives a basis of kind of credentials of why this person writing the letter is able to accurately speak on the skills of the Sam.
Yeah, it's contextual, right? You know why she knows about the math skills of fourth graders. What else?
Some concrete examples of things that Sam excels in.
Right, concrete. What else?
Compares it to age-matched peers.
Perfect. And it's short. And it should be short for a fourth grader because he just hasn't lived that long, right? But it is concise, it is credible and contextual. We trust her, right? It is concrete and it is comparative. So our letters for a medical student are not going to look the same as this, but the principles are actually similar. So for a medical student, we want them to be concise, a page and a half max. We want it to be credible. We want to say who we are. We want to describe the context in which we work with the student. And that's pretty important because there's so many different contexts in which we'll be working with the student. It's concrete, saying exactly what are the skills, the knowledge, the attitudes, the qualities that they exemplify, and if it will help the student, then be comparative. If you are brand new and you don't really have anybody to compare them to, then it is fine to leave this out. You can still write a strong letter without that. So here's my stepwise process, making sure you are the best person to write this letter, thinking a little bit in your head about how competitive the student is, drafting the letter, and then double checking for bias. And sorry, I'm having a little trouble with my screen here, so I'm just going to pause a minute to move things around. Okay. So number one, ensure you are the right writer. Students have probably asked you, can you write a strong letter, right? And that's an appropriate thing for them to be asking. They will often already know the grade they've gotten for the course when they ask that. So I don't take that as, yes, I can say that you're the best thing since sliced bread and you're in the top 10% of all medical students I've ever met, but I will say, yes, I can write you a strong letter. If you don't think, if this is a student who struggled when you were with them, then you should have a conversation with them, which is often a quick phone conversation, right? Because these letters this may be a student, if they didn't do well with you, they don't have a lot of options. You might be the best person to write a letter, even if they are a student who struggled, but having a conversation with them about that, being honest about where generally what you would be talking about in the letter, and then referring them back to medicine student programs for assistance if you think that you are not the right person. Questions about that? All right. Number two, how competitive is the student? Sorting them into kind of buckets in your mind. The buckets I use are the top couple of students I've ever worked with, a strong student, an honor student, just not the top couple that I've worked with, an interpreter or high pass student, and then anything below that, somebody who passed, somebody who borderline high passed, or anybody with professionalism concerns. And I can update anybody on Prime, but I feel like I've given a Prime lecture to most people here. And then draft the letter, and I'm going to go through that. The parts are an opening sentence with appropriate adjectives, describing yourself and the context. I'll give you some samples. The body is describing their strengths, being as generous and specific as possible. And specificity is really important. It keeps you honest, right? What did you see them do? What was impressive about them? I really do like to include anecdotes. The way I remember this is that I will I will write them in my final evaluation of the student. And then you have access to that, and I can talk to you about how to get access if you haven't done that before. But I use my evaluations. If it's been a long time, often the student will remember things that we did together. The student will remember notable patients, situations where they thought they did well or where they learned a lot. And I'll have the student write down, like, what are some things that you remember us doing together? And they'll send me that. And then a conclusion recapping their strengths. So the opening sentence, and this gets into the somewhat frustrating code that we speak in, but with an honors student, with a top student, a very strong opening sentence. I am pleased to write the strongest possible letter of support, very strongest possible letter of support, and kind of on down. We always are writing a letter of support. But so remembering that if this is a pretty strong student, you want to say, this is a letter of strong support. I'm really happy to do it. Describing your role and the complexity of the teaching setting and autonomy, and being pretty specific about this. A lot of hospitalists on this call, and I think maybe true with the primary care doctors too, that our overall number of days with a student might be relatively short, but they might be really intense, right? Like if we're working with a sub intern, we're like hanging out with that person for 10 hours a day, right? And Julia, if you're with a student, you're probably like really with that person a lot. And so being really specific about that, and being really specific about the complexity of the patients, if you think that is important for people to know. And then the body is, what are their competency-related behaviors? What are their clinical skills? What are their interpersonal skills? What was their knowledge base? What was their educational attitude? Avoiding comments on personal characteristics. So don't say they always had a smile on their face, because it's not about their face and they don't have to be smiling, right? That probably means that they had a really positive attitude towards working. And so using that kind of language instead. If somebody's going to be a urologist or an anesthesiologist, then I will comment on their procedure skills or some relevant skills. If they are going to be a psychiatrist, then I will comment on skills that I think are relevant to psychiatry. I keep most other stuff out because they have a whole packet that they use when they apply, and they have a personal statement. But if something, if somebody is like clearly really enthusiastic about teaching, and you know that they used to be an elementary school teacher, or that they've gone above and beyond in that area, or that they've done, really impressive health equity work, and they brought that to the bedside, then I would write a sentence or two. And then I only give a comparative if you think it would be helpful and if you have enough experience to do so. I do this for the top couple of students. So these are a couple of examples. The top one was a really superlative student. She was well-rounded. She moved care forward. She figured out what was going on with this patient. The second one was a high pass student who I thought was going to do amazing. And so I couldn't say that she was in the top 10% of medical students, but she did an amazing job. And I tried to really emphasize that from what I saw. Any questions about these examples?
I don't really have a question about the examples, but it's relevant that I sometimes kind of have a bit of a moral struggle or dilemma over like students or other learners writing letters. And it's, I feel bad about like not saying they're so totally awesome when they're, you know, they're like just, they're, they're great and I really like them and I want to support them, but I have to temper my language. And I don't know if I'm just oversharing, or do you have like a comment about kind of like making that titrating that appropriately?
Yeah, like this second one, she's done the second one. She's done amazing. This is an example of how I did that. I can't remember if I thought she got honors for my part of the sub-I and other people didn't agree, or if she had if she wasn't enough at the manager level by the end of the time I worked with her to give her honors. But I think I tried to emphasize like what were the things, like being really specific, what were the things that were really impressive. So I think it still feels bad, but or a little bad, I don't know. But I think that just being as specific as you can and giving examples. Helene.
What if there is something that you want to forecast, but say, for example, there's an area where they were currently weak, but they show promise? I mean, can you frame it in a way so that you feel that you're not being dishonest by withholding something that you feel is important, but frame it in a way that means you still believe in this person and they have room for growth or something?
Yes. If you can just hold this thought, because I'm gonna show you some examples where I do that. All right. This is another, actually, I don't know that this one adds that much. This is another, and I'll send you guys the slides. This is another very impressive student. And I think I put this in here to emphasize a particular story that his communication skills were at the level of a senior resident. All right. Here's some words to use for the best students. Outstanding, amazing, extraordinary, all of those. The outstanding, excellent, very good, good. Those are generally thought to be quartiles. If you can't put a student into quartiles, then maybe don't use those exact words. But outstanding is for the very top students. Excellent, very good, good. Don't use the good. Don't use good. Or actually, I can't say don't ever use good. Be careful about the context in which you use the word good, unless the student was really had a lot of areas for growth. So again, if they're a high pass student or above, right? High pass means they're an interpreter. They can come up with a weighted differential diagnosis. That's actually pretty good for a third or fourth year medical student. Sure, they can't like tell you all the things we want to do, right? But that's actually pretty good. So avoid good in those kinds of situations. Use the word improved for the student that Helene is talking about, where truly their skills were maybe a bit behind in some areas and they improved. So that's the situation in which you can say improved. You can also say they're already very strong X, Y, and Z skills, improved, but just think twice about that. Many readers, unfortunately, will kind of read the top and the bottom. Hopefully their eye will be caught by your 3-sentence beautiful story in the middle about the amazing thing the student did. But make sure that you recap their strengths and what sets them apart. If you would want them in our residency, say so. If they're not applying in medicine, I wish they were applying in medicine, but they're going to be an absolutely amazing radiologist, and you can put your comparative there again. These are both really strong summaries here. Okay. So if the student has struggled, confirm you're the right person. And in that situation, there's going to be a record of that, right? The program is going to already know, like they got a pass on internal medicine, they failed surgery. The program's already going to know. Those people can be excellent doctors, right? There is a residency program for that. People develop at different speeds. So for those students, we do use these more medium adjectives. The student was good, solid, pleased to recommend. The things that many of those students would be good, were good at something else. They worked really, really hard, and you should say that, right? They were really compassionate. They were amazing in how they implemented your feedback. So if that stuff is true, then you can use the stronger adjectives there. And this is the kind of letter where it's totally reasonable to run that by somebody who's written a lot of letters if you have not. This is a sample. I think I didn't write this one actually, but I think it's good. This is so he had a lot of fine qualities. He was enthusiastic, he was compassionate, he was curious, he worked really hard. His grasp of basic pathophysiology was sound, and his clinical skills were very good. I'll let you guys read this.
I'm sorry if you could see me appearing like I'm laughing. It was the considered sound that was like kind of pretty faint praise, right?
Yeah.
That's exactly what you're demonstrating here.
Yep. And I mean, I think, like, again, people will know this, right? He had a clinic. This person might have test taking deficits, might have a hard time producing the right answer when you ask them things on rounds. His clinical skills were not too bad though, right? So I think that's honest. Any questions? And then the fourth step is double check for bias, and I'm going to talk about that all together at the end. So any questions about writing letters for trainees?
I just wanted to ask a little bit more about how important this coded language is, because that was something that I feel like there is this secret emphasis on particular words that having not written a lot of letters, it's hard for me to say. And I guess my kind of solution to that would be to give very like tangible student is in the X percentile or whatever. But it just, especially for the struggling student too, it's like, how do you be kind and truthful, but still within kind of the confines of what the reader's expecting?
Yeah, I wish it wasn't coded, and we're trying to get away from that in a lot of ways. Like, so we used to have codes in our Department of Medicine letters, and we're not doing that anymore. We actually, I don't know that people here know that. Mike probably would, because he's seen our letters. We've taken all adjectives out of our Department of Medicine letters, and we say we don't use adjectives, so don't be looking for adjectives. And we just give quartiles, and we give quotes from people who work directly with the students. And that probably does remove some bias. It might hurt a group of students who end up in that last quartile. We honestly just started doing it, but it's the way that academic medicine is going. The dean's letter doesn't have those adjectives anymore. I don't know how to remove them from personal letters without disadvantaging the very strong students. And I think that the letter for the struggling student can be written in a way that is honest and help the students. To answer your initial question, Luke, if you're asked to write a letter for a student that was like a past student or had some issues, you honestly should do it, and you should have somebody look at it the first time until you get the hang of it. Mike, if it's okay to call on you, you might have some thoughts about this as a residency program director.
Nothing earth shattering, but many schools are doing away with quartiles. And so it's increasingly difficult to figure out how well students have done compared to their peers during their clerkships. So my opinion is that the letters are more useful now, absent that data. And so I think this is the most timely lecture ever. Thank you, Dr. Merrill. And I think my biased opinion, being on the residency associate program director side, is and I'm only speaking for myself, I kind of like the codified language because it just helps you understand kind of like what that person means in a language that many understand, not all, because otherwise you run into these circumstances where somebody who doesn't write many letters either writes something that seems to really undersell the person or really oversells the person. You're like, what does this mean? So my opinion is that at least a little bit of standardization can help transparency.
Great. All right, I'm going to move along to letters for colleagues. So examples are, you are asked to write a letter in support of somebody's promotion. You decide to nominate somebody for an award. A resident is starting a job and they ask you to write one of their letters. The general rules for learners actually apply. I use mostly really good adjectives in these, right? Because I don't have any colleagues that are fairly good, honestly. And so it's okay if these letters seem relatively similar. If there are any criteria for what you are writing a letter for, try to speak to those specifically. If it's an award, if they're applying for college faculty, if they're applying for some other particular position, try to get the criteria for that, so that you can say this person has really great leadership qualities. They'll be a great X, Y, and Z. So I've been asked, and maybe some of you have been asked, to write your own letter of recommendation. Shom, when he asked me to give this talk the first time, said, oh, this is a thing that happens all the time, please talk about this. And I was reluctant to it because, very honestly, I don't support that practice. I don't ask people to write letters of recommendation for themselves, because I think that most people are not glowing enough. It is too hard to be generous and specific. If you really want to, I guess, yeah. So I'm just going to say I don't do that. You can't. You often can't say no, right? If you don't have a lot of choices, you often can't say no. If I was asked to do that for myself, I probably would, and then I would ask a friend to look at my adjectives, and then I would send it to the person. I am going to get into another situation in which we write letters for ourselves. I'm going to talk about writing a cover letter for a position, which is essentially a letter of recommendation for yourself, and you can use those guidelines also. Any questions about that? All right. So bias in letters.
Sorry,
Yes.
Susan, on that topic, because it's interesting, having written a lot of grants and people ask you for those letters, I think maybe two things in response to asking someone to draft a letter. First, when I say draft, I think it's like you said, highlight the things. But the other way to do it is if they have to write a personal statement for this, that's what I ask them for, is like, please send me your personal statement, and then you can kind of crib off of what they've described so that you're making sure that your letter is in alignment with their goals.
Oh, that's great. And we do that with students and we do that with everybody else. If somebody's already written a cover letter for a position and you're asking to give them a recommendation, then you can use that. I like that very much. So moving on to bias in letters of recommendation, there is a bunch of data about this showing dramatic differences in the adjectives that we use in written comments for men and women and for white people versus people from historically marginalized backgrounds. And bias in letters can have a huge impact. What does the data show? There's been more written about men and women, so I'm going to start with that. We tend to use adjectives for men that we call agentic. Men do things. They are decisive, ambitious, strong, assertive, logical, and independent. Women are communal. They are nurturing, supportive, caring, kind, emotional, dependent. We are more likely to use standout adjectives for men. They are exceptional, best, outstanding, superb. We are more likely to write rhinestone letters of recommendation for women. I got one myself recently, unfortunately. I'm organized, hardworking, conscientious, and diligent. I am those things, but I am some other things too, right? What the study shows in terms of adjectives commonly used for people from historically marginalized backgrounds is that they also get the same and women, including white women, that we talk about their personal attributes. We talk about how delightful they were and lovely and mature and pleasant and reliable, whereas white folks and men, we are more likely using the competency related behaviors that we want everybody to be commenting on. A particular note on the word competent. They did a deep dive on this. Competent can mean different things, right? You can be the most competent third-year medical student that I've ever met, or you can be merely competent. So that's a fine word to use, but look at the context. Again, and I may be, I've said similar things to this before, but these are all lukewarm words, or can be lukewarm words in certain contexts. All right. So what do, right? Know that this is the case. Know that all of us are susceptible to it. It is unconscious bias. And if we slow down and think about this, bias is a factor of automaticity, right? So if we slow down and think about these things and review every letter to make sure that it is following best practices, that should help. If you are very specific on people's behaviors, it does take away some of the editorializing. We want to hear about everybody's competencies and accomplishments, and we want men and women both who are strong and decisive and caring and communal, right? And so if applicable, we should be using both kinds of adjectives. And just don't talk about people's personal appearance, don't talk about their pregnancy or other medical conditions. Any questions about that? All right. Finishing up a little bit more with this idea of writing yourself a letter. So I said not to do this, and try not to do this if the letter is going to be signed by somebody else. But you may in the future apply for some particular position, college faculty, or something similar to that, a medical director position, and you will need to write a cover letter. I've been on some search committees, and probably Shom has and Mike has and some other people on here. And the cover letters are becoming increasingly important as part of hopefully less biased selection committees where we have criteria. So I've been on selection committees where we looked at everybody's letter of or their cover letter and their CV, and we tried to evaluate just that based on that data. Did they fit certain criteria for the job? And so these letters have become more important over time. I think I already said that. All right. So you guys have lived a lot longer than, or somewhat longer than, definitely longer than a fourth grader, and significantly longer than a medical student. And so 2 pages is fine. I do try to keep these to 2 pages, single spaced. What I do in these letters, and what I think is an effective cover letter, is a really straightforward structure. Stating your case for yourself up front, starting with the stated criteria for the position and picking out 2 or 3 things, 3 max, that you think really highlight what sets you apart from other candidates. And then, so X, I am an exceptionally strong candidate for this position based on my X, Y, and Z. And then the second paragraph is about the X quality, Y quality, Z quality, tie it all together. So really specific and clear. And then adding something from the heart, if this is like really you've always wanted to be an X. When I'm on a committee, I like that. It's not enough. And other people may have an opinion about this. I don't like when you talk about the next step for you in writing, because it's probably the next step for all of the candidates, right? And if that's something you really want to convey, it's better to do that during the interview. But really, that's like not a reason to pick you over another person, right? And then concluding with a restatement of your fit for the position. And
Susan, I think I would note when you're saying in the beginning there, you talked about your skills, but I think you mentioned the fit specifically, so that you're reminding them how you match what they've asked for.
Yep.
And I think you said that, but just to say that again, that
yep,
using those words, I'm a good fit for this position because.
Yep. I mean, I would actually I would use I'm gonna have to go relatively soon. My that was a rapid response. I'm on the wards. I have a very competent senior resident, so I'm just gonna make sure that he is on the way there. I'm almost done anyway. All right. I always ask a trusted mentor, colleague, buddy to read these letters. So this is an example. This is with Shobha Stack's permission. She applied to be assistant dean for basic science education. She ended up not deciding she didn't want the job, but this is a letter that uses that framework. And so here's why she would succeed in the role. And then she just goes, here's why, here's the first key qualification, here's the second one, here's the third one. And she says ready for the next challenge, and I think that's fine, but she just sort of adds that at the end. All right. In summary, in letters of rec and cover letters, be generous and specific. Think about your adjectives clearly. Review your letters for potential bias, and ask for help when needed. It is tricky. Sorry, Sho, maybe you can facilitate the discussion for a minute while I just figure out what this patient is and whether my team is on the way.
Yeah. So I think one thing I was thinking about, Susan, as you were going through this, and feel free to focus on what you need to focus on, but there are situations where you might offer to write a letter for yourself to someone who is ostensibly the letter writer. So for example, I applied for SGIM lead a couple years ago. So it's like a leadership training program. And I asked Steve Finn could I draft a letter for you? Because he had to write a letter for me and I offered to draft the letter. So it's the opposite of someone asking you for a letter and you saying, could you draft it for me? Because I'm just super busy. So I'm curious, has anyone been in the position of offering to draft a letter for, I think I already explained what I meant. So Mike, you raised your hand. What can you mention any tips or pitfalls in that process?
I just wanted to say that it's happened to me in both ways that you said, Sean. One is someone has offered to write me a letter, but asked me to pre-write it, and then they would adjust it on their own. And then the other one as well, just you write it. And I've fallen into the same pitfalls that Susan outlined, which is probably under embellishing some of the things that someone else might embellish more.
Yeah. So when I was at UCSF, this was considered to be standard protocol. If you were asking for a letter from the division head, you draft it, which is why I thought Susan ought to talk about it. I think culturally things are a little bit different here, but it still comes up. Like if I need a division head letter, I promise you, I'm going to offer to draft it for Dr. Chander. And, she may say, don't worry about it, but she may actually, and has said, yes, please, thank you for that. I think under embellishing is probably the biggest pitfall there. And I wouldn't say embellishing, maybe praising, and not like selling yourself short in that letter, I think is probably the biggest pitfall. It's only been like once or twice where the senior person who's signing the letter will cross out something that I said about myself. I remember Bob Wachter crossing out, I said, and Dr. Mukherjee is the ideal person for this job, like he's saying this, and he deleted the ideal and he kind of said is a good person for this position. So, I mean, that'll happen once in a while, but I still think in some circumstances, knowing what it is you want the person to say and to say it for them. And then, if they sign it, they're going to read it. They can always change it if they need to. And in particular, in situations where there's going to be multiple letters and you may want one person to highlight one aspect of your work and another person to highlight another aspect, it does make sense to offer to draft those letters. So that's my 2 cents. Susan, I thought you weren't here, so I was giving my 2 cents on kind of like writing your own letter, but welcome back. Do you want to continue?
I mean, I think that is a little different. I still probably personally wouldn't offer, but I think that is a reasonable situation when it's, somebody who's in charge of everything probably gets asked to write many, many letters. I am sorry, I really should go because I haven't heard back from the intern. I think the patient is probably fine, but I have delivered the talk and then you guys can talk amongst yourselves. I am so sorry.
No problem. Thank you, Susan. Thank you so much. And we'll share your slides. Yeah, I mean, my practice has changed in that I don't, if someone asks me for a letter for various things, I won't ask them to draft it for me anymore. It just kind of feels icky. So I've stopped doing that. But I used to do that. And now I'll just say, I'm sorry, but I can't write the letter for you because I don't have time. But what other questions or comments are there around writing letters? I think we have a few more minutes. I have to hop off at 12:55, but I would love to help coordinate a little bit more discussion around this topic in the remaining time.
I was just hoping you could comment on the approach to, say you have a bottom quartile student that asks you for a strong letter and how you might either be frank with them that you maybe can't write them the strongest letter, but you're still willing to do, like, assuming that the student is otherwise professional and things like that. How do you approach that situation, and is there kind of a standard?
That's great. I think you said it exactly what you said. I mean, we're not helping anybody by kind of couching what is going on in a way that's ambiguous or they have to figure out what you're saying, you know? So I will say, I don't think I can write you the strongest letter. I'm happy to write a letter based on the time we spent together, but let's think for a minute, is there someone else that could write you a stronger letter? And I've had this conversation a few times, in particular with students who were like started the rotation with me, and I knew they were going to be doing better by the end of the rotation. So I'll say, can you know, what about Dr. this person who you worked with at the end of the rotation? And then sometimes I'll, you know, they're like, you know, I think you're the best person. And then you just have to write an honest letter for your impression. Does that answer your question?
I'm
Yeah.
kind of wondering, Shom, if under that circumstance, it would make sense to ask the person to draft the letter.
No, I mean, we wouldn't do that with the student. Students should never draft their letters of recommendation. That's
Okay.
not something that would ever happen. But I think it's a good thing to think about. But I wouldn't say draft your letter, but I would say, okay, it sounds like I'm the best person to write your letter. Let's sit down and talk about some of these things. You know, the patients you saw, can you help me remember what patients you saw? You know, if my notes were insufficient or my evaluation of the student was insufficient, then it's really grasping for those stories. So it wouldn't be a letter draft, but Helene, I think you're onto something. I think it would be like really trying to revisit the time together and think about what you can highlight. Anyone else have input on that kind of situation where it's just tough to write a strong letter for someone? Yeah, Mike.
This comes up for me like very frequently, I would say. And on the resident side, asking for letters of reference for their fellowship or their next job, and then on the student side. And my rote response has become, okay, I could write you a solid letter for sure. And then I would couch why I think maybe I'm not the best. I only worked with you though for 1 week, or I only worked with you early on in your stay, in your training. So maybe someone later who worked with you longer would be better. But, you know, if you take me up on a letter, here is what I'll say. I will emphasize that you are a good communicator and that you know, worked really hard and that you know, were really good at differential. You know, I literally tell them what I'm going to emphasize. And then on some level, it seems a little bit unfair because they don't have this context that even we have, you know, in terms of what that means. But at least I feel like I've told them what I'm going to say, and I've couched it. And if I'm still the best person for them, great. I'm going to write exactly what I said, and then I feel fine with it. And you know, on the resident, you know, the student letters, like Susan just pointed out, are all positive. You're like not telling anything about downsides unless they've like done something really bad, like unprofessional or whatever. But on the resident evals, you can be much more honest because they'll still get jobs. So I'll tell people, frankly, I'm going to say, hey, if you put me as a reference, I'm going to tell them that you are below average. You're like below your peers in terms of getting your notes done, but you're excellent at the bedside and you have an excellent medical knowledge. And that's what I'm going to say. So use me if you want or not. And then they still put me, and then I say that exactly, and then they still get hired. So it's really a total different world writing letters for residents and students. The students, like if you put anything negative, that's like a disaster. But then for residents, I put negative stuff all the time and it really doesn't matter. And I've actually gotten feedback from employers that said, we are so thankful that you put that transparently. You know, we know they all have issues, and thank you for putting them out there. As you can see, we still hired this person and now we'll pay extra attention to them. So I just want to point out the disparity between like what you're sort of like what the culture suggests that you put for resident evals and references and students.
Great. Thank you, Mike, for sharing that. It's nice to have kind of a real world perspective on these things, both from the perspective of a writer and a letter reader. Veronica, I don't know if you've already put the evaluation in the chat. Kind of as we continue to chat, maybe you can put that in there for folks to give feedback to Susan. And I interrupted someone.
Sorry, it was me fussing with my microphone. Shom, it's Julia. I had a quick question about accessing previous evaluations on MedHub, so that if a student that you worked with 6 months ago or 9 months ago approaches you to write a letter of recommendation, is there a quick and easy way to find your own sort of comments from your assessment of them?
I'm not actually sure. Does anyone know the answer to that, Mike?
Yeah, I was filling out the evaluation, so I caught like 80% of what you said, Julia. But yes, you can just access all of your evaluations you've written in eValue, the medical student thing. And so I do the same thing that Susan Merrill does, which is I write a more elaborate MedHub eval for all the students. Because then if they ask me to write a letter of rec, I go back to that, look at it, and then, you know, use the language and the way of doing it and put that into the letter.
Great, thanks, Mike. Mike, next year you're going to be the leader if Susan doesn't have the bandwidth. Any other thoughts or questions about letters of recommendation? Anyone been asked to write one and had a particular challenge that came up?
May I please ask a separate question?
Yes.
Thank you. So none of my students have asked me for a letter of recommendation yet. And so I'm now trying to think about, like, when I was a student, I think that I had some attendings who said at the end of my rotation, I would be happy to write you a letter of recommendation. And so now I'm trying to decide, like, my N of medical students is still on the lower end. And so now I'm trying to think, okay, who is it? Only when I've interacted with someone who I feel like they're absolutely outstanding that I give them like, are they the top 10% of people I've ever interacted with? Is that who I say? I'd be happy to write you a letter of recommendation, knowing that they're probably an incredible applicant for residency. And I also wouldn't want my naivete in writing a letter of recommendation to harm their potential prospects. And so I'm just trying to think of, like, who should I be preemptively cherry picking and saying, like, I would write you a letter of recommendation?
Yeah, that's a great question. I don't think I've ever said that to a student. Any thoughts on, like, when do you actually reach out and say, hey, I really ought to write you a letter?
Well, because partially, I mean, presumably eventually somebody will ask me, but what if they don't? And this is a skill that I want to work on. Maybe I should start telling people, like, hey, you should think of me in this role, and then I can help you out, maybe.
Yeah.
Well, it sounds like your intuitions are, I mean, the thing about writing a letter is it's a lot easier to do when it's an easy thing to do. So it may be even just your own litmus test of what constitutes your top 10%. So, if you're sort of want to practice with the best, because they're always the easiest to write, you have plenty of examples, then I guess that's what I would say is, you're volunteering, you're adding work. And it's work you want to do, so make sure that it's work you want to do.
I think the other scenarios I think about it, like I said, I've never actually done that, but thinking about my mentee students, I know some of the students don't quite realize how good they are and feel like lack some confidence in, like, understanding how good they are in certain contexts. So if I sense that about a student, I'll look at Susan. If I sense that about a student, I might be like, you're doing awesome. I mean, I'm happy to write a letter for you. I think that's another context. Susan, please don't take us into the patient room. I don't know where we're
No,
going.
I was gonna go to, like, the nutrition room. My team is amazing and they don't need me for the rapid response. The patient's fine now, so I'm just gonna listen at the end.
Sounds good. Well, I think I actually have to hop off for a 1 o'clock, another teaching thing. So I'll hop off. Veronica is the leader, so this meeting should not end when I hit leave. And please do fill out your evaluations, and back to Susan for any other questions. Thanks, Susan. Thank you so much for doing this.
Yeah.
Susan,
Sorry
the
about
question
that.
that was asked by Katie was, when do you volunteer? When do you let a student know that you would write for them? Or is that something that you do? And how do you choose which students to make that offer to?
I don't really worry about a good student not asking me so much. So I haven't normally, like, but I also have had students where I wish we discussed it during their third year. So anyone that you think you could write a really good letter for, if that's something that you like to do, that is fine. It is not mandatory. These are adult learners managing their lives, and it is not our responsibility. But if you're like, gosh, this is like one of my top students, or this student just did such a great job, and especially if you think they're going to ask you for a letter later, I think that's fine. I don't have a particular rule about that.
It does sound like the tip from Mike and Susan is to start writing really great evaluations.
Yep.
So that you can almost practice your letter writing skills by how you write those evaluations, so that you can begin to think about those adjectives, think about the examples, and then you've pre-written the letter of recommendation, and it makes your whole job easier. So maybe that, and don't they get that feedback anyway? So
Yep.
you're kind of helping everybody by investing that energy in writing a good eval.
Yep.
I guess the question that comes to mind for me here is, say we have a truly excellent student, and I acknowledge I'm a more junior faculty, and the perception that a lot of students have, probably correctly so, is that a more senior kind of position of power within the school is going to have a letter that carries more weight, and that students are going to want that more. Like, would a student be better off getting a sparkling letter from me, or a very good letter from someone more senior in the department?
I'm going to ask Mike to talk about this from his perspective, but in my mind, they are much better off getting a sparkling letter from you. When I look at letters, I look at the context, and I know what that context is, right? I know that you're working with that student really intensely, and they're presenting to you, and I know that you really know their clinical skills. I've had students ask me if they should have just the site director write a letter instead, and I say no, because I think that somebody who worked with them specifically, I don't really think that most evaluators worry about how senior you are. And Mike is nodding, but I don't know if he has other stuff to say.
I agree completely with what you said, Susan. I think there's a little bit of a networking game still in medicine, even with the match, so if it's somebody who, if you're applying to programs and then one individual actually knows many people in those programs or something, that potentially could boost you, but just their stature in the institution, I don't think matters too much. I share Susan's opinion.
Plus, people get more than one letter. And so if you're a junior person, they're really asking for your lived experience of them, as somebody who, and it's really about those details because you worked closely. And if somebody higher up hasn't worked closely, then you're a better letter of reference because you have more specifics to comment on.
I'm muted because I'm in the nutrition room and you can hear that machine. Any other questions? All right. Thanks so much for your attention, guys.